And now a moment from Your History and Health starts first with Dr. Richard Brown.
Welcome to Your History and Your Health Comes First by Dr. Richard Brown. Well, today, this session, I want to talk to you about something that's very, very important to all of us. Health. Health, of course, is important to all of us, but specifically sleep, getting enough sleep and how important sleep is to your overall health. And then the second part of today's session, I want to talk to you about the third social determinant of health, which is access to health and quality. So let us start. We know that sleep is very, very important. If you do not get enough sleep, you get irritable, you can't function as well as you should. Even little children, sometimes I've seen babies, toddlers, when they're whining and crying and get real irritable, I've heard mom say, okay, you just need to take a nap. And guess what? That's what they need. They take a nap, they wake up, and they're fresh, and everything is fine. So that is true for humans, of course, and adult humans for sure, that sleep is super important. So I want to focus on an article that was done by an individual by the name of Joe Leach. He did a lot of research on sleep and sleep deprivation. And he had about 10 things that he identified that was important to your health. Number one is sleep is important to reducing your weight. If you don't get enough sleep, you have a tendency to gain weight. In fact, short sleep duration is one of the strongest risk factors for obesity. In one extensive review study, there were children and adults with short sleep durations of 89% and 55%. And when they got done with the study, those that had received less sleep were those that developed obesity or had a more likelihood of developing obesity over time. So if you're trying to lose weight, getting quality sleep is absolutely important. All right, number two, good sleepers tend to eat fewer calories. If you get enough sleep, then the body is not triggered in such a way that it stimulates, your diet and your interest in eating more. So if you get enough sleep, you're comfortable, you're in balance, and it reduces that weight gain problem. So studies show that sleep-deprived individuals have a bigger appetite and they tend to eat more calories. So sleep deprivation disrupts the fluctuations in appetite and in hormones. And some of these hormones are tied to people's appetite. So poor sleep affects hormones that regulate appetite. Those who get adequate sleep intend to eat fewer calories than those who don't. Number three, good sleep can improve concentration and productivity. Again, you can attest to the fact that if you do not get enough sleep, the next day you're irritable, you're tired, you can't function as well as you should. Maybe you stayed up late or out and about and still tried to go to work the next day. Well, that next day isn't going to be too productive. It's going to be difficult to concentrate. You're going to be irritable. You're not going to get as much work done as if you had gotten enough sleep. So the cognitive part of the brain is impacted by not getting enough sleep. A study on medical interns provides some good examples of scientific research. There were some interns that had a traditional schedule that expanded work hours for more than 24 hours. And then there was a group that had work schedules that was only about 8 to 10 hours. Well, those who had the long work schedules had significant number of mistakes. And it's been well proven that in hospitals across this country, lots of injuries take place, something like 200,000 a year deaths and injuries take place because of mistakes that are made in hospitals. So I think it was about 10 years ago that the American College of Surgeons and others who regulate, the internship for physicians changed the law and made it mandatory that interns could not be on duty for more than 8 to 10 hours as opposed to the 24-hour cycles that they were subjected to before. And so as a result, there has been a decrease in the number of injuries and mistakes that are made. So on the other hand, getting enough sleep enhances your memory. It creates a situation where your brain functions better. There's certain chemicals that are secreted that fires off the synapses and cause you to be able to somewhat be smarter or think faster and more accurate in what you're doing. I know that there's research out there that says that if you're studying for an exam or have a great presentation that you need to make, one of the best things you can do after you've done all your studying is to get a great night's sleep. And if you can get a good night's sleep, then your chances improve in terms of your brain operating at its maximum capacity for whatever it is you need to do that next day. Number 4, good sleep can maximize athletic performance. Okay, sleep can be shown to enhance the athletic performance of athletes and of individuals who just have to perform athletically. There was a study of basketball players who were long sleepers and then those who didn't get enough sleep. And the result was that the less sleep duration had been associated with poor exercise and performance and functional limitation. And so those that didn't get enough sleep just didn't perform well. They weren't able to live up to their potential and perform as basketball athletes that they were supposed to perform. There was another study done on women, and they found that poor sleep was linked to slower walking, lower grip strength, and greater difficulty in performing independent activities. So the longer you sleep, the better you are at getting the chemicals secreted and your energy levels restored so that you perform at your maximum potential when you wake up. And I know there's some of you out there, I know I've done it on occasion, have participated in something that is called a power nap. So maybe during the day, when you get a chance, you might close your door, lock your door, or go to a secluded place and take a quick 5-minute or maybe 10-minute sleep. And it renews you when you wake up. You wake up, you feel much better. You can perform better. You're not sluggish. You can complete the rest of your day. So sleep is super, super important, even at the workplace. Number 5, poor sleepers have a greater risk of heart disease and stroke. Okay, sleep quality and duration can have a major effect on many health risk factors. A review of 15 studies found that people who don't get enough sleep are at a far greater risk of heart disease or stroke than those who sleep 7 to 8 hours per night. So again, sleep, super important for your health. Number 6, sleep affects glucose metabolism and type 2 diabetes risk. Experimental sleep restrictions affect blood sugar and reduces insulin sensitivity. In a study in healthy young men, restricting sleep to 4 hours per night for 6 nights in a row caused symptoms of prediabetes. So if you know anything about prediabetes, there are some symptoms that occur that cause you to feel like insulin in working properly, and you may get some pain, you may get some itching, you get several symptoms that cause you to be in that category of prediabetes. You may not have diabetes, but you get those symptoms simply because you didn't get enough sleep. So poor sleep habits are also strongly linked to adverse effects on your blood sugar in the general population. So you should get at least 6 to 8 hours of sleep a night if possible, because it is so very important to your function the next day. Depression, that is another area, which is another chronic disease that can be affected by not getting enough sleep. Sleep is the thing that restores you. It gives you energy. It gives you a new lease on life, so to speak. The next area that was discussed by Mr. Leach was that sleep improves your immune function. It helps fight the common cold. There were some studies that were done where they actually introduced some cold bacteria into some individuals. And those that got enough sleep over a course of time did not actually develop the cold. Those that did not get enough sleep did come down with the cold. So sleeping actually impacts your immune system. And so it's very important for that factor as well. Inflammation. Sleep can actually decrease your propensity for inflammation. There's been studies done on that. There's also been studies done that, and I kind of alluded to it at first, that if you don't get enough sleep, it affects your emotions and your social interaction with other people. Again, you may become irritable and difficult to work with if you don't get enough sleep. So sleep is super, super important for you. That's my comments relative to sleep and the importance on your health and on the importance of making sure that you do all that you can to take care of yourself, to make sure that you stay healthy. So now I want to turn to that third determinant of social determinant of health, which is health access and quality. So the conditions in which we live and work and play and age and worship are known as social determinants of health. And the differences in social determinants of health that people may find themselves in terms of where they live and work and all can have an impact on the diseases and your health. There's lots of certain ethnic minorities and socioeconomic groups that are systematically have limited access to healthcare, and so their health are impacted. And so we know that public crises creates a problem for disparities, such as economic uncertainties create disparities for your health. I mean, the COVID example, COVID-19 pandemic that we're in is an example. When the pandemic hit, it exposed the fact that people who are a minority, that were minority or people of color, and who held health disparities, that it showed up more amongst them than in other people because they were already at a disadvantage. So there's many interventions that should take place to avoid this systematic inequities that exist where health disparities are concerned. And that is the biggest challenge that we face now. How do we get rid of these unfair barriers, these systematic ways in which people are made to be unhealthy? So we know also that many people in the United States cannot get health care that they need, okay? Now, Healthy People 2020, which is developed by CDC as a way to improve the health quality of individuals, have identified several objectives that they want to pursue to make sure that the population is healthier than it is now. So one of the objectives is to increase the number of adults recommended for evidence-based preventive health care. So if you do happen to go to a doctor and get some advice and information from the physicians, depending on the physician and the circumstances around where you're getting that health care, they may or may not refer you to places where you can receive preventive care. Preventive care is very, very important. If you can prevent something from happening, of course, then you don't have to deal with it. So one of the objectives is that they want to make sure that they increase the number of adults who are recommended for evidence-based preventive health care. A second objective is to increase the proportion of people with a usual primary care provider. Okay, everyone should have a primary care provider, and we know everybody does not. But if you have a primary care provider, it helps your health tremendously, because that person knows you, that person can understand your history, that person can refer you to wherever you need to go to get additional care beyond primary care. And you get a team-based approach usually when you have a primary care provider. The system that we live in, the healthcare system, doesn't necessarily allow that, although there's been many efforts to create an environment in which you do have a primary care provider. And I'll speak about the community health centers, which are a government system that's located all across the country. Their major focus is on outpatient care, major focus is on preventive care. And once you get into the system, you will have a primary care provider. I want to also say something about having a primary care provider and being referred to a system where preventive care is involved. And that is, and specifically where the community health centers are concerned, they all have a sliding fee scale, which means that whether you have insurance or not, whether you're poor, whether you have lots of money or not, they evaluate you based upon your ability to pay. So they have a sliding fee scale set up so that if you can only pay $10 or $20 or $15 based upon the assessment that they do, then that's all you have to pay for your primary health care. But if you have insurance, of course, they will bill a health insurance company. And so many people who have Medicaid and Medicare go to community health centers because that is a great source of reimbursement for the care that is provided at the community health center. So primary care, increasing the number of primary care doctors for people is a major objective of Healthy People 2030. Another example is they have an objective to increase the proportion of people with dental insurance. Now, dental insurance is something that lots of people don't have. There's more people without dental insurance than medical insurance. And dental insurance is very, very important. There's lots of diseases and injuries and nutritional problems that develop when you have poor oral hygiene. So there's some strategies to reduce financial and other barriers to dental insurance access. And some of them are private. The federal government now is trying to make sure that dental insurance can be obtained by those who are on Medicare. But to show you how poor health can develop from having poor dental hygiene, there's a list of linkages to poor health that was listed in this particular article. So poor dental health can lead to cardiovascular disease. Can you believe that? Cardiovascular disease can be linked to poor oral health. You wouldn't necessarily think of that. You'd think of poor diet, poor exercise, and heredity, but your dental health can contribute to that particular disease. Poor dental health can cause respiratory infections. There's respiratory infections that can be linked to poor dental hygiene. Dementia, which I was very surprised at. Depending on your oral health and what's going on in your mouth, it can contribute to loss of memory and forgetfulness. Pregnancy issues were also identified as issues that can occur based upon you not having proper dental care. Diabetes complications. Diabetes is a very complicated disease, as we've talked about before, and lots of things contribute to this particular disease, but know now that even poor dental health can also contribute to diabetes complications. Also listed, which I was very surprised at, erectile dysfunction. What does oral health have to do with erectile dysfunction? Well, the research suggests that there's diseases and circumstances and things going on for lack of dental health that can contribute to erectile dysfunction. Fertility issues go along with that. There's some fertility issues that can occur as a result also for not having proper dental care. And then finally, there's kidney disease and some cancers that can develop all through not having proper dental health, or some of this is related to the fact that you can go to a dentist and the fact that they look into your mouth, they can identify things that a medical physician may not identify because that medical doctor isn't looking in your mouth most of the time. Although in recent years, it's become a standard practice that they're asking primary care doctors to look into patients' mouths, because there's things that can be found there that they ordinarily would not show up in all of the tests that they may run on the blood and urine and everything else. But until you look into the mouth, you don't have the whole person diagnosed. After all, dental care is a part of the human body, and it's part of overall health. Your mental, your dental, your physical, your spiritual, it all is a part of keeping one healthy. So one of the other objectives that Healthy People 2030 has identified is that they want to increase the number of people who have health insurance. So without health insurance, you can't even get to a doctor sometimes. This puts people at increased risk for serious health problems, and there's lots of barriers associated with getting health care, and insurance is one of them. And in this country, as we know, if you have health insurance, then you have access to the best health care in the world. But if you don't have health insurance and you can't get in to see a provider, then you may as well not live in America, because you can't get the health care that you need. And again, I want to plug the community health centers again, because they are a place where, whether you have health insurance or money or not, you can absolutely get health care. Another objective for Healthy People 2020 is to increase the portion of people with prescription drug insurance. We know that even Medicare, which is the universal United States healthcare for those that are 65 or older, do not have proper prescription drug insurance. And so you have elderly people not taking all of their medicine like they should, because they're trying to save it, because they don't have enough money to buy some more. And so they take maybe part of it, or they don't take all of it, which can significantly contribute to ill health. And so the cost of drugs are important too. So another objective that Healthy People 2030 want to do is to increase the number of people who can afford the cost of the medication that they need to stay healthy. Another objective is to reduce the proportion of hospital emergency room department visits in which the wait time, is very, very long. We know that if you can go to an emergency room, if you've ever been there, they don't take care of you right away. And matter of fact, those who have the greatest life-threatening injuries will get taken care of before you. And so if you don't have a healthcare provider, you don't have health insurance, or you don't have a place that you regularly go to, and you get ill or your children get ill, you go to the emergency room. And the emergency room is not necessarily the place that you want to go if indeed there are things that are going on that could be taken care of without going to the emergency room, because you could sometimes die there because they don't get to you because there's other people in front of you. So it is important to decrease those emergency room visits by having a primary care provider, by having health insurance, by having money enough to pay for your medication that you need, and all those things that are associated with the social determinants of health. So I want to leave you with this. First law of nature is to save yourself, okay? It is important to stay healthy. And the system as we know it may not keep you healthy necessarily. because it's complicated and it's confusing. And unless you're plugged into it and don't have a health disparity, or you aren't poor, or have resources, then it's a very difficult place to go. So make sure that you stay focused and get enough sleep and stay healthy, protect yourself, protect your children and your family, and stay healthy until we see you next time. Thank you.
This has been Your History and Health Starts First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.